the story of Abraham and Sarah. All right. So Abraham had been promised, you're going to be the father of generations. But here we are with Sarah and nothing is happening. It was Sarah who actually proposed Haggai to Abraham. All right. And from that we know Ishmael was born. All right. The only bit was she was a surrogate, but not the conventional way we do it these days.
You said that men shy away from seeking this kind of help. And the way you said 1 out of 8, first of all, those are statistics according to your research, right? And I'm so sure from this 1 out of 8, probably if you're doing like a group of 24 people, a very small number will come to seek for this fertility treatment and options. Why?
So that's a very, very important question, because once we understand why men don't come, then we're able to know how to engage them. So number one, it has to do with historical or deep-seated cultural belief that, number one, a man is just supposed to be able to procreate. That's one. And again, just go back to the Bible. Nobody ever believed Abraham had a problem. All right? So there's that deep-seated issue that the man cannot have a problem in terms of conceiving. The number two, for men, with the moment they mention infertility, they almost always want to equate that to how competent they are as a man leading a household. All right? And so they don't want to come out as being told they have an infertility problem, because then they feel like the space of a man as the head is shaken. And that has to simply be how society has anchored the man to be. The number two, women, since time immemorial, are the ones who, I would say, the role of childbearing was simply assigned to them. All right? Even, just look at these two stories. Even my favorite one, the one for Hannah. But it's the female who's supposed to be childbearing, all right? But they forget it takes two to actually make a child. So number one is that historical, deep-seated aspect, and a man feeling that they will be emasculated if people tend to know that I cannot say children, right? The number two, it also has to do with also how female-centered medicine has been. And I'll explain this. If you walk to any hospital on any day, you'll always find more women than men.
Yeah.
Even now, this week, as I'm the one taking my mom to the hospital for treatments, I actually just can't help but notice the same thing. Even if it's the man who is sick, more women will have brought him. So in any space, you find more women seeking healthcare compared to men. All right? Then it means it's easier for a female to actually approach a healthcare provider and say, I'm having a problem conceiving vis-a-vis men. The number two, also the number of tests that we have tended to bring forth in terms of solving the issues of infertility. An ultrasound here, all right, a HSG there, a hormonal profile there. For a man, when you tell them semen analysis, for a while they're like, how am I supposed to get that out? Or hormonal profile, you mean I can have hormonal issues? So it's that whole bit of female sort of centered medical practice. And that has to stem again with people tending to think that infertility is more of a female problem. So most of the diagnostic capacities and treatment options have been geared more towards women. Even IVF, when you look at it, people tend to think it's solving a female factor issue. All right? Then the other bit possibly is biological variance. For a female, they would know something is off because every month I get a menstrual cycle. I get to get my menses like every month. And that's how we have actually kept on teaching our girls and teaching our women, all right, even throughout the clinics. So it's easier for them to know something is off because of the irregularity of my cycle. So it's easier for her to be able to come. And then, of course, now, for them, if I'm not getting pregnant in 3 months, something is pretty off. For a man, the only end game is, am I achieving a conception or not? All right? And then I kind of feel sad for men, because you could be partnered with a female who actually has a contraceptive, is not informing you. You know that? Huh?
Yes.
Yeah?
Yes.
Or she actually tells you I'm on a contraceptive, that's why we're not conceiving. So for men, they will never easily tend to think, maybe I'm having a problem. Are you getting it?
I do.
You're seeing it? Top on my head, that's actually how I would look at it. And then also in terms of social support. So granted, we have come and we have found this is the problem. Who are more likely to get support? It's women. And you know why? Girls tend to talk.
Yes.
All right. I mean, this week I've just been shocked at how easily my mom makes friends with people as they're waiting for treatments. Women tend to talk about their problems more. They will form support groups quite easily and share success stories or failures and sharing tips. For men on the other side, then tend to feel isolated. And probably it's now even for men to start advocating for themselves and generating safe spaces for themselves where a man can feel safe to come and say, hey, we have been married for 2 years and nothing is happening. What could be the problem without him being emasculated? Yeah.
Okay. You have actually broken it down so well. For me, I would have just generally said it's a societal, the way the society has shaped that. And because I am not a professional in the medical field, planning this event has made me read a lot. And in this reading a lot, I have come to realize that not all medical professionals are emotionally supportive. There is this lady that I was reading her story, and she said that her file was just stamped infertile. You can imagine that she was broken. So as a medical doctor, how do you ensure that you give them the services as well as the emotional support?
I think number one is actually destigmatize the situation. All right. Let's go back to a few years ago. All right. When even when mothers lost children, their files would silently be labeled. We had to learn from those mothers who told us we felt unseen, we felt unheard, because everyone would walk quietly around us. So now we have come to know, asking those women directly, would you like me to actually voice it loudly that you have lost a child? Would you like me to put you separately? Has gone a long way. So even for this couple, us being able to call the problem as it is, destigmatize the situation, goes a very long way. So that now we stop, I'm not able to have a child. Can you just whisper? No. The same way we're able to say, I have fibroids. The same way we're able to say, I have endometriosis. We destigmatize the situation and start shedding so much light on this problem that people feel very, very comfortable, number one, speaking about it and seeking help. All right. But over and above that is actually being quite gentle with the client. Just listen to them. Listen to their story. At the end of the day, it's them who are having the problem. You are simply walking the journey with them. Yeah.
Okay. Is there a specific situation that you saw the emotional support helping a patient?
A lot. And let me tell you something. For a couple who are going through the treatment journey, whenever you find a man who is fully supportive, I always tell the lady, you're quite lucky to have somebody who is 100% present, comes in for reviews, is willing to do the test that we have recommended, and is willing to actually take the next steps. It goes a very long way. Because what sadly tends to happen, the moment you've worked up the couple, and it's a female factor of infertility, you can always see the shoulders, dropping and wondering, am I going to be left? Because we do know some men will actually leave. And it happens, all right? So it goes a long way when both of them are able to say, this is our story, and this is our journey, and we are going to walk it together to find the solutions. It's really a game changer. And the same thing also happens when it's the male factor infertility that we have found. The women actually saying, we are going to find the solutions together. So the couple being able to own the problem and working together goes a very long way. Because sadly, and this now explains why, majority of the times it'll be the female client who is coming in alone. It's because they're kind of thinking, this guy will leave when he finds out this is a problem. Yeah.
Okay. And you have explained to us how emotional support can come a long way, especially when it comes from a medical perspective. The medical practitioner and a partner, and what about the community? What role do you think we should play in giving this people support?
Number one, stop asking people when they're giving birth. All right. If you sit with married couples who have been trying to conceive, they find that to be the most demeaning statement. When are you getting children? And I've seen some who will actually write, before you start asking someone when they're getting children, ask themselves what else could be happening. They could have been trying everything else. They may have gone for various IVF cycles and nothing seems to be working. So perhaps it's actually just creating that space where, okay, I know they haven't gotten a child, but it's not my business to ask when they're getting those children. And don't even make those, sometimes you can make a remark which is supposed to sound good, but it's not. I'm praying for you when you're going to, that's still not right.
Backhanded comments.
Exactly. All right. Sometimes be very sensitive around such questions or such statements. The other bit that we also find women crying a lot and asking us to raise our voices around is a mom who keeps on losing her children. And when they come to comfort her, they tell us, "Sijali utapata mwingine." I think one day we'll have to do about, miscarriages and child loss and how that statement deeply hurts those women. This was the only child I had at this moment. So telling me I'm going to get another one, when? And some of them don't even want to wake up and face another day. So for most of them, they have said, if you don't know or you don't know how to say it correctly, just be quiet. Yeah. So for the community, number one, stop with the backhanded comments and perhaps create very warm and open spaces. Don't discriminate these women from children-related church events, because that also tends to happen at some point. She doesn't have children, so we're not going to invite her for DVBS, for example. She doesn't have children. For instance, how would she know how to advise people on childcare? For instance, they continuously engage this couple as they're trying their very best.
Okay.
And don't also give unsolicited advice. It comes off very badly.
Just because you think you have experience, right?
They didn't ask for it, so don't give it. However, if the couple openly asks for it, then you can give your advice and probably linkage with the correct persons.
Okay. So as we wind up, I have asked most questions about fertility, but I don't know whether I have exhausted. Is there anything that you think I have left out?
Perhaps the myths.
Oh, yes. Oh, I remember actually it was part of the questions and I was told to address it. But I kind of asked the myths personally, the myth and misconception that men do not go through these fertility challenges.
Yeah.
Yes. So the other myths that are there.
So the other myths, number one, let's completely break away from saying it's a women issue. It's a public health issue. It affects men and women. 40% of men will be affected. All right, 50% of women will be affected, and 10% of them you can't find the cause. All right, so it's actually a public health issue. So that now both men and women come to seek help. Again, when I go to church and they ask me to talk about it, I always ask the pastors directly. When you call women or when you ask people who want to come and be prayed for because they want to get children, how do you phrase it? And they'll actually say they have been asking for women to come. Now it should be people who are praying for a child, instead of, so that we break away from that whole thing of thinking it's a women issue. Then number two, there are those who tend to think that the only treatment option for infertility is IVF. No. It is targeted care, depending on what we have found is the underlying issue. Then there are those who tend to tell you, Doc, IVF is quite expensive. And I know we're going to be discussing about this more during the event. We do have insurance companies that are able to actually finance the treatment journey towards being able to be a mom or a dad. There was a very misconception, but I think with time, people have actually come to see it was a misconception that children born through IVF are not normal children. There was a time that was there.
Yes.
Gladly with with time, and especially with the West having taken up so much of the assisted reproductive techniques, we're able to see the children are actually just quite normal children, like the rest of other children. All right, and then now we need to be able to voice and create a safe space for surrogacy to be able to answer the need for children for those who, like I'd indicated, it will be quite dangerous for them to be able to get children. Yeah.
Okay, thank you so much for that. Is there any advice that you'd give to anyone who is facing fertility challenges out there? You can look at the camera and tell them.
So the other way we had actually framed this question is, what would a man and or a woman do to improve on their chances of a conception? So number one, it's to actually take up what we call preconception care. And during preconception care, these are the following elements that we'll be discussing with you. So it's free consultation for our viewers and readers. So number one, when you come in, we'll also always be telling you to tell us who you are in terms of your health. Every time I ask a client that, like, hi Veronica, tell me who you are in terms of your health. So it means I want to know, is there a chronic disease you're being treated for? For example, diabetes, hypertension, epilepsy, any surgeries that you could have had before. We're raising an awareness of fibroids some few weeks ago with national media. Have you had treatment, for example, for fibroids? And was it an open surgery? Was it a closed surgery? And we know why we ask that type of question. Number 3, we are in the era where we're having very young children who have received cancer treatment and are living now to being women who actually are desiring children. That becomes a very, very important answer for us to know, because we want to know, was fertility sparing done before treatment was started? And again, I know we'll be addressing that. Fertility sparing is something that we always encourage the male and female clients to always be asking about before they start their cancer treatments. Because now people are living beyond cancer. All right. Then other than that, I want to know, what drugs are you taking? Because some drugs will definitely not be safe for you as you try to conceive and once you have conceived. And this is something we always tell patients who have underlying chronic diseases to always let us know about it. Then number 2, we'll discuss about nutrition. Like we have said, there are micronutrients which will be very, very important for anyone to be able to achieve a conception. That done, we'll also work with you and guide you with a nutritionist on the proper nutrition to improve your chances of fertility. Then we'll look at your weight and your BMI, all right? And if it's quite concerning, again, we will encourage you to take up some lifestyle modification to bring the weight down. I know you're wondering, I'm seeing extremes of weight. So what happens with the underweight? The underweight, they don't have a menstrual cycle. Did you know that? They don't, all right? Especially for people who are, can I say gym rats? Okay. If you're engaging in quite some amount of physical activity, especially the very sporty women that we know, running marathons and the type, constantly on the underweight, they don't have a menstrual cycle. So one of the things is to actually help them gain some good amount of weight, just ideal weight, and the menstrual cycle would kick back. Then the other bit is genetic screening. It may look like a far-fetched thing till you sit down with someone and you ask them, is there anybody in your family who has been treated for a recurring health issue? They're like, what do you mean? And sometimes, without profiling a patient, you'll be able to guide them correctly. Sickle cell disease is something which any couple that could be at risk would always benefit from getting the sickle cell analysis done before conception. We'll always tell you, raising and taking care of a child's sickle cell disease, it's quite a daunting task. So genetic diseases, again, be able to screen for that. Then we mentioned other lifestyle modifications, smoking, taking alcohol, even caffeine. Just how much of coffee are you taking could have an impact. And substance of abuse or pleasure, again, because those ones will not be quite safe. And then now, alerting the man and woman, we don't usually use the word couple these days to be quite sensitive, on their fertility awareness in terms of the calendar, all right? And what they could actually do to be able to increase their chances of conception. We mentioned the ovulation calendar and being able to know the fertility window to increase their chances of conception. Pretty much top of the list.
Actually, I just remembered something. There was the question of infertility and youths. Do you think as youths we should start facing our fertility plans?
The answer is actually yes. All right. And especially when you have to take care of the youth, especially tertiary going clients, universities and colleges. Anytime you find someone who is, the first time, okay, we have taken care of the sexually transmitted infection. The second time, safe sex practices become an anchor in their treatment plan. And especially for the female, and also now for the male, we have seen, you want them to be aware these infections, if not correctly treated, will actually end up with tubal blockage. And we said that's how most of them will actually end up with IVF. All right. Also for the male client, you want them to know this recurrent, STI episodes would actually lead to obstructions. So we don't want to get into the future and we're having, we call it obstructive zoospermia, where the sperm count is close to 0 because of an obstruction which came from constant STIs, which led to blockages. So it's about safe sex practices for the young people, all right? And then the moment someone desires a conception is to take up the preconception sessions and counseling, like I've actually alluded to. So then we're able to prepare them, all right? So for instance, if you're really taking your alcohol and you're constantly, several sticks of cigarettes, it's for us to be able to tell you what the impact of that would be on infertility. I forgot to mention something else. Physical exercise is quite important, and also mental health screening. All right. You may wonder, mental health screening. How does that actually come in infertility? All right. Chronic stress leads to high levels of cortisol. The lady will not ovulate. Yeah.
Okay.
Yeah.
And for the youth, apart from what you said, safe sex practices, are there other lifestyles that you think the youth should be careful of because they're going to affect their fertility in future?
Substance abuse, alcohol, smoking,
Okay.
And then sleep. Actually, maybe 6 to 7 hours of sleep. When we come to the doctor's office, this is why we actually explain why sleep is important and how it can be linked to fertility.
Okay, so when you have less sleep, you might...
Erratic hours of sleep, cortisol levels will actually just jump up. Cortisol is something very, very important when it comes to reproduction and fertility.
Okay, and some of these youths, because I live among them, they are my friends, they keep saying that, oh, I'm going to get my eggs frozen, or I'm going to get this and this. Are those options really?
Fertility preservation is actually something, all right? It's actually quite something that, but most of the time you'd find us having the discussion mostly around people who are going to receive treatments around the pelvis, especially with radiation. All right, like cancer treatments like radiotherapy and some chemotherapy options. That's the time when that discussion comes a lot. But also, given that more women are pursuing career and delaying childbearing, that could be something that women need to be very much aware about. All right, oocyte preservation. So we call it gamete preservation. So the oocytes and the sperm preservation versus an embryo preservation. All right, which again I know we're going to tackle more about. But it's something that people should be aware that they can do.
Okay. All right. Thank you so much for that. Yes, for your parting shot, what would you like your legacy to be like in this fertility medical field?
Oh, medical field?
Yes.
That I was simply the young girl who was able to break down medical knowledge into something that the public can consume quite easily. All right? So that now we demystify a medical condition, make it so palatable to the public that they're able to come and seek help. All right. So instead of someone just hearing IVF and thinking this is only something to be offered in the big cities, all right, break it down so much that the person comes to understand it's a medical intervention and it's actually accessible to you irrespective of where you are. All right. The whole point is share information in terms of where are these fertility centers, because you'll be shocked at how many people, when they have been told they're sending you to an IVF center and their mind blocks. So tell me to go to Nairobi and I'm deep in Tharaka. How am I going to get there? But being able to create these channels, all right, and like creating an access sort of them in terms of information.
Okay, thank you so much. I have learnt a lot and I hope you have as well. This marks the end of our interview and our learning session and free consultations. Do not forget to join us on 30th of August at Golden Tulip from 8 a.m. to 3 p.m. for our fertility awareness event. The keynote address will be given by one and only Dr. Grace. Thank you so much. See you next time.